Hello, guys, and welcome to this episode of Business Bits. In this episode, we are going to talk to a wife and a sister running a family-run business, basically, that they've been running since 2016. I think 2016, am I right about that? And we're going to get into the nitty-gritty of what it's like to have a business with your family. So first of all, welcome, guys.
Thank you.
And thank you guys for coming here. Before I take it any further, maybe Sandra, because you are kind of like the embryo to this company, and the idea was initially yours, and there's a reason why this was your idea. Can you start off by telling us a little bit about what Hidroxa, your company, is and what it is that you solve?
Yeah, sure. Hydroxa is a company that sells something called iontophoresis devices. And those are to treat excessive sweating of the hands, feet, and the armpits. So that is basically what we do right now.
And why was this something that came natural to you to figure out that this is a problem that you could solve? Because it's not something that when you sit around on your couch, you figure, I have a solution to this problem.
No, that's right. First of all, I'm a medical doctor. So I always, work with patients with different kind of medical conditions. But to me, excessive sweating is much more personal than that, because I do suffer from that condition myself, actually. So it's become better now these last few years as I grew older, but when I was a kid and a teenager, it was really hard for me. And one problem with excessive sweating is that the doctors actually don't know about this condition. So a lot of people who seek help for this, they don't get the right information, they don't get any treatments, and that's still a problem today, like 30 years later or so. But when I think about my childhood, like my first memory of having sweaty hands, for example, because I have sweaty hands and feet, it was like, in Sweden we celebrate something called Lucia. And I was standing there in school holding a candle like this, and I was about maybe 8 years old or something like that. And so I was holding this candle, and then I felt like something was dripping from my hand to the floor, and it was just sweat. So it was running down both my hands, and I was doing nothing special. I was just standing there, and we were singing, maybe a little bit nervous, but not too much, And I also remember that I told my mom this was a problem, and she was a little bit like, okay, maybe it's not, maybe it is. But we went to the doctors anyways, and they were like, no, there's nothing you can do. And then we went to the doctors a few times, and then it actually took me until I was 25 when I got my first treatment for this. So I never gave up, but it took me a long time. And I got Botox in my hands, and I met this great doctor who was working at a sweat clinic in Uppsala in Sweden. And I was so amazed by him, first of all, how he handled the patient suffering from this, because it is quite embarrassing, and he just did it so well. And he was such an amazing doctor overall. So I actually started working with him in his sweat clinic in Stockholm, just like a half a year later or so. And then I was also studying to become a doctor at the time. And then when I finished med school, I started working at their sweat clinic in Stockholm and in Copenhagen as a doctor. And it was then that I heard about this anti-sweat machine, iontophoresis device, because the patients were asking about it. And I didn't know what to tell them, because no one knew, not even my good doctor, my mentor, he didn't know about it, the method either, almost. So then I figured, this is something interesting. Why are people asking about this, but no one knows anything about it? So I wanted to know more. So I started to read about it, and then that's how it all happened.
Yeah, that's the embryo to the idea, and obviously what you guys have today, spoiler alert, is not a clinic where you guys solve this problem for people. You have a different kind of solution in Hidroxa. Can you tell us a little bit about what Hidroxa is and how Hidroxa solved this problem of excessive sweating for people?
Yeah, so this device, it is a medical device, but it's not like most other devices, because it can be used at home by the patient itself. And that's one of the things that is really good, because a problem is often that methods are expensive, they require doctors, nurses, and you have to go to the clinic, but this is different. So that's why it's suitable to sell on the web, and that's what we we're talking about, right?
Yeah. I remember you came to me there in 2016, or both of you. You had research about iontophoresis, and it was clinically proven for a while, right? Already.
Iontophoresis devices have been around since the 1940s.
Yeah.
And was the go-to method to treat excessive sweating for many years.
And the patients came to you to ask you basically that, is this really working? Is it safe and all that? And you basically,
where can I get it, basically?
And
there were no it was really hard to find somewhere to buy these devices.
And so I mean we started to look up the competition there to see where can you buy these devices, and the stores looked really scammy. Like, I understand that people were very skeptical about it, so I mean, I did a quick research and saw just that the competition wasn't good at all. And I have a background in web development, SEO, how to rank in search engines, and also I had worked with an big e-commerce store in Sweden for 4 years. So I quickly could see that we can do this better than the competitors. We just needed to find a device, and that was when we started to look for one.
Yeah.
But at the same time, Jimmy, you also understood that this is not such a advanced device, right?
No, correct. So in the beginning, I started to prototyping to see if I could manage to build something up without knowing all the process of CE marking and that process, which is huge and complicated. So I was very naive in the beginning, I guess, but I created one. It was nothing we would possibly be able to sell, but
a working prototype.
Yeah.
There's something very cool to me about the idea that this is kind of like almost like a lost science about iontophoresis, that it's been around since the 40s, and then you as a kid going to doctors and nobody knowing about it, and it's kind of being reintroduced to the world. I'm sure that's how the pyramids were built. I'm just kidding. But I just made that connection. I'm sorry, I've been on the internet for too long.
It's the same thing.
It's the same thing, right? But so obviously, you guys knew of the method. You obviously knew what your brother did. When did the idea come for you, Sandra? Okay, I need to talk to my husband and my brother about starting a family business where we are going to go into this together. And why did it seem natural to do it with your husband and your brother?
I must say that I didn't consider myself like an entrepreneur. I consider myself mainly a doctor, if we're talking business-wise or career-wise. So I actually didn't think about it like that at first. I just saw the problem, The patients need a solution. They're not getting treatments. Even if there were some other treatments available, they were hard to access. And I was thinking, could this be a complement to those available treatments? And how can I help the patients to find these devices? Because I knew they were out there, mainly in Germany, but it was really hard. I could barely find them on the web. And I was like, I as a doctor, I cannot recommend them something that I'm from a company that I don't trust. I need to know that it's something, first of all, that's working, and that it's something from a serious company. So that was basically, we were just sitting like by the kitchen table talking about it, and I presented the problem mainly, basically. And I said, I really want to help these patients. And then I think you said something like, I think this could be, what did you say? Do you remember?
I thought it was, I saw, I had done quite a few companies before, a few failures, and I with that I've learned that execution is a big part of like starting a company. Ideas is as a start, but I could see the competences were very unique, like your medical background and the special treatment area of hyperhidrosis. There's not a lot of doctors. How many doctors are there in that? Like hundreds in the world?
Yeah, I don't know, but it's not so common. As I said, it is a problem that doctors are not educated on the subject. So yeah.
Yeah, so that alone, I think it's a great start. And then I saw Jimmy as an electrical engineer, and I call you sometimes Nikola Tesla kind of guy. He can invent everything, like really, really good, like technically wise. And I believed from the start that you could build a machine, and we are soon to be launching it. Spoiler alert there as well. But I really believed in your competence there, as well as my own, because I before 6 months before that, I started an IT consulting company that was mainly focused on e-commerce at that time. So I knew that I could handle the marketing, the technical parts to sell this online, and with all those other competences and the competition that I saw, for me was just like a home run. I mean, then we started to find resellers because we realized that it's going to be really hard to build one first. So we pivoted a little bit that, okay, let's buy someone else's device and white label it basically. So we researched, like we went to page 5 on Google because all of these companies were
we had to
really bad on
really
SEO. So that was the opportunity there, right? So we find this old guy, Mr. Dole. He was like 70 years old and selling these devices.
Sounds like the Ninja Master. Like,
Mr. Dole.
I love that you call him Mr.
Mr. Dole.
I'm sorry.
It was all emails like regards Mr. Dole. But yeah, so we researched a few, but he seemed really serious, and we bought a test device in what we say.
It was the summer of 2016.
Yeah.
And then
we gave it to Jimmy to dissect it. To see if it was quality enough.
Good enough. Yeah. Exactly.
I just want to add here, the people that are perhaps following the channel Business Bits, and you see Nikola here talking about how he started the company Hidroxa. Maybe you're confused because in the last episode, Nikola was talking about how he started Zendev. So Nikola is not an actor that's here in every episode pretending to have started a company. That he actually started both of these companies in parallel. And we're going to get back to how you did that and what the situation became for you because you ran these companies in parallel. But before we go to that, I want to go to this ancient technology of iontophoresis. Tell us, what is it? Like, how does it work? And how did you first hear about it? And what is the technology behind it?
Yeah, I actually heard about it from patients. As I said before, they came to me in the sweat clinic where I was working, and they were asking, "Oh, what about iontophoresis?" And I was like, "What? I have no idea."
It's crazy.
Yeah, and then I started Googling it, and I realized, okay, there is something called iontophoresis device that can treat excessive sweating. So I went to my mentor, my medical doctor, Dr. Carl Swartling, who taught me everything I know about the excessive sweating, basically. And I asked him, and he was like, "Oh, that's an old method. I'm not sure if it works. We don't use that anymore. Botox is really good." And I was like, "Okay." But then the problem was that not everyone could get Botox, and there were side effects and not working for everyone and so on. So I got interested in this method. But when you start reading about it, it sounds really phony because basically when you explain it, it's like you have 2 water bins. You put 1 electrode in each, then you place each hand on each electrode, and then you put a weak electrical current.
It sounds so scammy.
Yeah, I know.
But it sounds scammy, but it's not.
Yeah, it sounds so scammy. And then you have this weak electrical current, and then you sit like that for 20 minutes, like about 10 to 12 days straight in a row, and then your sweating starts to decrease. And so trying to sell that on the web, you need to be really thorough on how you present it. And also when you're talking to, like when I talk to my doctor colleagues or to patients, I sometimes I start with, okay, this sounds really phony because it does sound like something from
But the clinical study says that it's 98% success rate, or
I think I would say about 90%. It's successful for about 90% of patients, and that is pretty good. That's pretty equivalent to, for example, Botox. But the thing is that there are the studies made on this. When we talk about medical clinical studies, today we have certain architectures or designs of these studies, and the studies made on iontophoresis, most of them are pretty old because the method is old. So these studies they don't live up to today's standards for a medical study. But we have something called best practices as well, and this when I was started to look internationally, like in some countries in Germany and in Great Britain, this is part of the great best practice for treating excessive sweating. So it's not. We have a lot of clinical experience, even if we don't have like the highest quality clinical studies because they are old. So it's still, and these like best practices and clinical studies, they can be equivalent in value, like when you talk about the clinical evidence for treatment.
When we talk from a business standpoint, and I've followed your journey along the path, and somewhere along the line, obviously, the end of the company that Nikola and I started became part owners in this as well. What I found on your website is what you mentioned earlier. It had to seem legit, right? And I think, Sandra, you are the secret sauce to that. And, you know, when you watch that feedback and all the reviews, your customer support that you've given to those people that have contacted you is what legitimized the entire product. So when people talk about starting a business and having all the elements, I'm 100% sure if Nikola and I, read up on iontophoresis and try to sell it online, we wouldn't have this kind of success. So that's a huge part of it, understanding that even though it is, an old technology and it can look at first, at face value, a bit, scammy here and there, it's also quite evident that at your starting point, people didn't know about you and your brand, but people were still taking that risk, and it is quite an expensive device. It costs about 500 euros, and people were still ready to pay those 500 euros because it's very obvious that for them in their life that it is a very real problem. And when I look at the reviews that you guys have had throughout the website, I'm really proud of it because I'm a part of it, but you should be even more proud, obviously, that you really are changing people's lives with these kinds of devices, because it's not just the physical problems that you're sweating, but it's, like you mentioned for yourself as a kid, all the mental issues that come with it. Can you tell us a little bit about what you've heard from your customers, and generally being in this industry for so many years, what are the mental effects that your patients have had, and what are the effects of solving that, basically?
Yeah, it is. I'm trying to find words still to explain what it actually means to live with excessive sweating, because first of all, doctors don't know about it, as I said, and when they do know about it, they don't take it as a serious problem. It's often, put in the same category as people who want to have larger breast or do a liposuction, cosmetic. But it's so much more than that. And I'm trying to, when I'm sitting with my fellow doctor colleagues and I'm talking about excessive sweating, they're like, what, excessive sweating? What? They don't know about it, and they're laughing. They often laugh.
But they're doctors. They should know about it.
I know. All doctors cannot know everything about everything. But if you are presented information, the reaction that they're laughing about it is so provocative for me, because I see, and studies also show that people who suffer from excessive sweating, they have a lot of negative effect on their life quality compared to, for example, other skin conditions like acne, psoriasis, and things like that. So they are really suffering, and it is like, I'm trying to explain what I usually do if I'm talking to a doctor, for example. I'm trying to explain it, so I say, oh, imagine you would be sitting here, we would be talking, and the sweat would be like running down your face for no obvious reason. People would go like, oh, are you sick? How are you doing? Are you really nervous? And then I try to tell them stories that I heard from patients. For example, like there was a salesperson, some sort of seller, and he was in a really important business meeting, and he had excessive sweating just from the face and the armpits. And they were talking about something real serious, and the sweat started running. He wasn't really nervous. It was just the hyperhidrosis, the excessive sweating. And then the business didn't go through because they thought he was lying because he was sweating so profoundly. Yeah. So it's, it's a signal that your body sends out. Yeah. It's a sign of stress or sickness or something else, but it's not actually. It's just the excessive sweating, but it's telling people around you something.
Like fake signals, like it's not real. They misinterpret.
Because it's part of your body language. Yeah. You're talking with your body's talking, saying things that are not true. Yeah. So it's always about being misunderstood. And then the feeling, the thing that happens with time, if you're used to being misunderstood or that people say that it's disgusting, is that you start being nervous for certain situations. You weren't before, but then, okay, I'm going to have a meeting today. I'm going to stand in front of people today. I'm going to talk to someone today. I'm going to be at a party today. And then you get nervous ahead of and then it just becomes a vicious circle. And I also compare it a little bit to, people who are, how do you say, I think you say incontinent, that they like the urine just, I think it's the same with the sweat. It's the same feeling that you're leaking and you want to stop it, but it just comes out and it shows and everyone's looking at it. And Yeah, so it's but basically I try to boil it down to that it's body language gone wrong.
Gotcha.
Yeah, something like that.
And I think now we're gonna start to get into the nitty gritty, what it's actually like to run this company as a business, what the pros and cons are of it. I'm gonna start with you, Nikola. Come back to what we mentioned a little bit earlier, that your story in this was that almost at the same time as you guys started this, on this hand side, you started Zendev with me.
Yeah.
And both companies ended up doing really well, and you were a little bit torn of how to divide your time now between us. Can you tell us a little bit about your thought process there, and your idea initially going in, and how you figured that you would make that time management work? Was it that you thought that this would perhaps be a hobby, but then turned out to be a really good business and so on? What was that experience like for you, starting two companies in parallel that ended up going really well?
Yeah, so I mean, we started Sendev a little bit, maybe 3-4 months before this, and that was going well. We had, I think, 5-6 employees at a time when Sandra approached me with Hidroxa. And I could see that the time that I would have to put in, like, to set up a web store for, like, it would take me 2-3 weeks to put up an MVP, like really MVP. And for me, I think I just want to see if it worked. And I didn't actually think longer than that, basically. I just wanted to test it out. And I think we talked about this earlier, that you ordered the first 3 devices on 3 days before you guys were having your first child, right?
I was checking all emails just to go through like the time perspectives of it, and I realized that we ordered the 5 first devices 3 days before our first son was born. And then I saw there were some email conversations, some mails that I sent to the German manufacturer from the maternity ward the same day that my son was born. So we can just say that Hydroxa and our first son was born basically in the same day almost.
That's very cool.
Yeah.
And then, I mean, we sold the first device like a week after that. So, I mean, that for me, with my experience in e-commerce, like, that's really fast result. It was only 1 device, but then I knew, all right, this is something to it. And I ran this in parallel. My main focus was Zendev. It took a lot of time, and I did this basically on the weekends, and the sales were growing over 2017. We started to sell more and more, but didn't require too much time from me still. So basically continue with it in parallel. But then I think it was 2018. Then it became a lot, and I was becoming a lot in Sendev as well. I was probably one of my worst years, like personally, because I worked so much, and I don't think I thought this through, that running these 2 businesses in parallel. So the work with Sendev were just more and more and more, and also I saw the opportunity with Hidroxa. It was more and more work. So I mean, I was obviously getting my salary from Sendev. I didn't feel fair to you as a business partner that I could see that I was spending like few hours every day on Hidroxa, and I was like, okay, how can we use Sendev in this story, basically? And then I also asked our developers at Sendev to help me a few times, and I could see that we really needed the resources from Sendev. So basically I came to you to say, like, yeah, let's see if we can connect all this, and Sendev can maybe become part owners. So we sold was it 24% of the company to Sendev, because we also needed the capital to have developers, but also then we got a team of marketing. So we have 3 people in marketing helping us. We started with 2 people in 2020, Angela and Irena, and basically at the time we had, I think, enough cash to cover their salaries. But then Jimmy also quit his job to go full time on this. You had a really good job at Volvo as a consultant, so I was trying to convince you for a long time to quit. And it was I say a big sacrifice to quit, I guess, economically.
And can I just ask there, what was your experience? There's always that separation anxiety even from your company. So when Nikola came and presented the idea of Zenda taking a share, or before that it was the three of you, and I think you had a third each in the company. How did you feel about that idea, and was it a hard sell from Nikola's side?
Not that hard, actually. One of the main concern I had was that I really wanted to have the majority share, me and my wife, since it's our baby, kinda. And
Your first baby.
Yeah. So that was kinda important in the beginning, I felt, but I mean, it gave us so much opportunity with the company, so it was a no-brainer in the end.
And it was still a little bit, still in the family or close. I mean, you and Nikola have been friends for a long time. It's not like just someone came out of the blue that we never saw before. And
it's hard to find someone more reliable than Sandra also. No.
Yeah, because we didn't want, take someone, and I had a fear that if we would take on like investors from the outside, I would lose control because I have a vision in my head how I want this company to be. I want it to be like medical focused, serious, and not just focused on the money and the finances and so on. So.
And we have had already going back and forth, you and me, regarding that, because I'm a little bit more business oriented and you have a really high integrity, and we had to go back and forth there in the beginning to see how much should we push the sales. And you taught me a lot also about building the brand. Basically, I think that's a big part of Hydroxa's brand, that we really have integrity to help.
And I think that shines through the website, and I won't reveal any names or deals now, but right now you're talking to a company, a really huge company that wants to sell your device, and they came to you and they know of one of your competitors, the one that's the biggest one in the world, that's maybe 10x your size right now, but they still felt that your approach was much more legit. You had a doctor behind it, and that's where that integrity comes into place. Even when there is a bigger player, if you do it with great integrity and always have your client's best interest at heart, not just try to sell the product to people that it's not going to help. Because I know that Sandra, you're there at the customer support, and if there is a case where this can't solve their problem, you tell them to go to a clinic, right? You're not trying to force this upon anybody.
We know that this is a good product. We don't have to push it on people who don't need it. If there are better options, better solutions from them, that is what we're going to recommend. Because I know that we will be successful without taking advantage of people in a hard position. So.
And then the $1 million question, Sandra, and I mean it revolves all of you, but Sandra, I would say, is in the most vulnerable situation here. Is you're working with your husband and your brother, and any business has a lot of ups and downs, right? It's just the name of the game.
We don't have any.
Yeah, I mean, the beauty of it, right, is at the ups you guys get to celebrate together, and what's more beautiful than to get to celebrate it with your family, right? But then the downs, the downs are tough, right? And the stresses of the financial stresses and so on. What has it been like to run a company with your family, basically?
That is a huge question. I don't even know where to begin.
Let's start with one end. So what are the pros of running a company with your family?
The pros, you were talking about them a little bit there. I mean, we have a common goal. It's something that interests us, that we can talk about, that motivates us and makes us how do I say, interested, and that we do. Yeah, we want to talk about it all the time.
Yeah, for us three it's fun,
it's a common interest.
But the rest of the family, on family dinner,
that Christmas dinner has to be horrible. The sweat problem, man. Let's talk about
that. But
especially my wife Sanna has had a lot of patience with the discussion.
Definitely.
I love you, Sanna. Thank you for the patience.
And even in our relationship, she's had a lot of patience as well.
I'm so passionate about this business, and I want to talk about it all the time, but the rest of the family on the family dinners, we have to go off and sneak and talk about it.
Exactly.
For Christmas, for example, we go in the kitchen
Where
and
the business deal are made.
talk, this order, or what are you going to do?
But, you know, when things are going well, like you said, it's so exciting and you get it so excited and it's like, and you talk, I would never imagine that this would happen so fast. It's going really well, and we can do this, so many opportunities, and you know.
Yeah.
And then also it's interesting that you get to see the professional side of your partner and your brother, you know, see them shine, do their thing. It makes you love them more, I think.
I agree 100%. Just in general, to have somebody to share with. I remember Nikola and myself, we were driving by the coastline here in Croatia a few years back, and we were listening to a podcast of a famous Swedish watch brand, Daniel Wellington, and he told his story of running his business. And he's kind of like a solo entrepreneur. He started himself and obviously made a huge success out of that storyline. But I remember Nikola and myself looked at each other at the same time, and we just said, how boring would that be? Like, you have nobody to share it with because nobody cares as much as the people that initially started it. So that's the beautiful side. On the other hand, when we talk about the cons, obviously you have a personal life with your brother as well, but even more with your husband. What would you say are the cons? And for other people that want to start a company with their family, what to watch out for and how to approach it?
I mean, to really explain this, I would have to go in a little bit into detail about what it's been like in this 5-year journey. As I said, it started with us founding the company at the same time as we had our first kid. And our first son, he had the colleagues and everything. He's a really active kid, we can say, at least. And it was a huge difference for us in our lives to have kids, and it is for everyone, but for us I think it was even a little bit more because he was so demanding. So, you know, doing these things at the same time, at first it wasn't too much with Hydroxa, but as it started to grow more and more, and we also wanted to be there, you know, with our kids. I have a lot of thoughts on how to raise a family. I didn't want him to go to kindergarten too early, for example, so he started when he was 2. And we kept him home and trying to balance, you know, family life and your job and your kid and everything. And then when he started kindergarten, I didn't want him to go too long days, so he went 6 hours per day and so on. And then in 2020, when we had our second kid, that was when Hydroxa really started to go fast. Things started to happen. I think it was like the spring of 2020. And we were expecting our second child in late August, but he actually came 6 weeks early, and we were not prepared for that. I mean, he was healthy and so on, but we had to stay in the hospital for a bit, and there was a huge, you know, change in our family with another kid, a really small kid, you know, and he needed like extra food through his nose and things like that. And
just one question here.
Yeah.
Did you answer customer support emails in the hospital?
Yes, of course I did.
I'll add that. And I was actually independent of this. I was talking with Nikola about this yesterday, and we talked about how people are different. And I said to him, like, your strong suit is your alertness to answer messages. I think it was in parallel with my lack of that ability. But it is a really strong. I mean, when you talk about good feedback, it's good answers and fast, right? It's as simple as that, and obviously you have the know-how in the background to make that work. For you, me, and I know this because I know you for a while. I've known that sitting in a car with Nikola and myself, you'll sit in the back seat and start doing work while we're driving in the car, just to take advantage of every moment you can to put in the work, right? And can you tell us a little bit about that time management when you have your family that you want to focus on, and obviously you don't want to be a negligent father or a husband, and at the same time you want to have a successful company? What's that time management like for you to find time for everything, which is hard for all of us, I think?
It's a real struggle, I would say.
I believe that.
I mean, you don't know what would happen the next day, since you try to do a plan. What will I do this week, for instance? But then the kindergarten calls and the kids are sick, or then we maybe get an order from a Norwegian hospital or something. Then I just need to throw out everything and send that order, ship that order, for instance. So it's hard to, it's very stochastic.
Right. A lot of unknowns.
Exactly.
Yeah, with the kids.
And is there a dynamic where, like, in both ways you are taking responsibility for your family? Like, even with the company, obviously for a good future for your kids, you want to make sure that the company goes well. So that's one way of investing into your family. And on the other hand, it's obviously spending time with them, which you can't replace with anything. Is that something that's at the back of your mind as well? All right, I've quit my job right now, so whatever we're doing here, this has to work now.
I have a good education. My wife has a good education as well. I'm not that economically worried at this point at all. So that's nice to have that securedness. Yeah. But at the same time, I really want Hydroxa to work.
Yeah.
It's
passion,
my
right?
exactly.
Yeah.
And at the same time, I really want to bring my kids to the best they can be, and I want to be a caring dad and all of that. So it's really hard to find the time to make Hydroxa great as well. And as you mentioned, time management is something I have had to learn during this period. And you need to find all the time slots that you can to be able to do work for Hidroxa, basically.
Yeah.
So
I remember
it's
when
a lot of late evenings and I mean, as when we drove down here to Bosnia with the family, my intention was that we need to do some driving or work during when I drive the car down here.
Yeah, so optimistic.
Yeah, it didn't work. I can't say that much, but
Everyone started puking.
Yeah, it was horrible. But the intention was there at least.
But you are really good at finding these moments. If it's 30 minutes there and 10 minutes here, you're really good at that, I think. But then also another thing that we have to consider is also like when you do a startup, in the beginning you are everything. You're not. I mean, it was 3 of us, but still there's so many roles, and the main focus for us was that you were going to build this new iontophoresis device for our company, with all that means, the CE marking process and everything, which is quite complicated. But then you also have to be, the one that packs, the prints manuals, that
ships the
orders, and
team lead Irene and Nikola.
I mean, in a lot of ways, I don't know who the official CEO is, but it seems to me obviously that Sandra is like the niche expert, and then when in these early phase startups, I think they call a CEO like a catch every obstacle kind of person, and that's basically what you do. And a lot of people, I think, will glorify a position like that, but it's really a horrible position.
Yeah, a lot of dirty work.
Yeah, a lot of dirty work, and you're usually not qualified enough to do most of those things and paperwork and so on. But what I found fascinating about you, and your work in the company is your love for hardware, right? And that is kind of the next step for the company now. And you mentioned it from the very early phase. You started developing your own product. Now we're kind of at a stage with Hidroxa that we're about to put out a new machine that's primarily developed by yourself. But what are the struggles in getting out a machine like this? Because there are a lot of regulatory things that need to be in place because it's a medical device. What did you have to learn about that? It seems to me that, certainly putting together a machine like that works well and is of good quality is a challenge. What did you have to learn in the legal department to be able to move forward with this?
Quite a lot. I mean, it's a bit overwhelming at the beginning. It's just so many standards to take into consideration and to evaluate what you need to do to comply to all the different standards. Sometimes it feels really paramount. However, the only way I managed to start the process was to actually start to read the standards themselves and try to just.
How many pages are?
I don't know, but there are several hundreds.
You can explain what a standard is, maybe for those who don't know.
So a standard is a standardization document that tells you what the product needs to be fulfilled in order to be released on the market, to have the approval to be sold within EU, for instance, right. or America.
For example, there's a standard for electrical safety, there's one for biocompatibility and so on, and it's basically 100 pages of rules in each.
Yeah, exactly. So you need to try to find out which rules applies to you and how you need to cope with those requirements in the design itself.
And how you prove that you've live up to these requirements.
Yeah.
And
Here's a question, Jimmy. I said earlier that Sandra is in the toughest situation in the sense that you're her husband and this is her brother. But the more I'm thinking through it now, you might be in the toughest situation as well. I mean, the same could be said for Nikola, right? Because Sandra is very, you know how it is. You have your husband and your brother, so you're very close to them to share how you're feeling, right? But obviously tensions go in all directions, right? Have you felt, and I guess this is a question for the both of you, that it's tough to give each other like harsh criticism or like just communicating, okay, this is not enough right now, because you have to communicate it not to your wife but to her brother and to her husband, right? That entire dynamic, what has that been like for you, Jimmy? Like having a family business, basically, in that sense.
Yeah, I mean, first of all, I think me and Sandra, we have always had a really good relationship. Like we have, since we were 20, I think we talked every other day on the phone for like 20, 30 minutes. So we know each other very well from the start. So that's, I think, a great base for this, I think. But at the same time, there's no one that I can get as quickly angry at as my sister. So for actually it's been a positive thing, because I can feel actually more safe in saying things that don't work.
Very safe.
Exactly, yeah.
But as far as for Jimmy, I think I'm really happy that we're doing this, because we got to know each other. Because you don't have the same interest always. Maybe now a little bit when we're a bit older, but for me, I think it was just a really nice chance to get to know you a lot better, because when you're doing something together, especially something really hard, that's when you really get to know someone. But I think, I mean, a lot of people say that you should not like start business with your family or friends. I've done both. I mean, I think I've started companies with 3 of my best friends, and you were one of them, and also then with my family. And I think it's more about, it's going to be problems, and if you don't know each other, there will be problems. And then I think some people just, if it doesn't work out, they quit and then they blame each other. But if you're a stable person, you stick it out and you work through it, and then you get an even deeper relationship, which is not easy, I would say, but I definitely think that people take the easy route when they say that, oh, don't start a business with your family or friends. For me, it's been super positive. Obviously not fun at all times, because I'm also like part owner of Sendev, and we own part of Hidroxa, and then I get in the middle of
that dynamic.
them and myself. We are like best friends, and then I get in the middle of all of us, which like it's just weird, because Sendev is a separate entity. The best for Sendev is one thing, and the best for Hidroxa, and I just sit there in the middle. And but I'm really proud of you guys that you took the steps of becoming entrepreneurs as well, because you guys are not the biggest risk takers. That's like one of the things that I think it's hard for a lot of smart people that really maybe keep them at stable jobs their whole life, because they don't dare to take the risk and
see all the obstacles. It's to some extent an intelligence thing as well, right? Because if you can't understand all the potential obstacles that could come on the road, and that's why.
And you focus on them. Like compared to me, I'm like just super optimistic.
You and I were just so stupid. I mean, we just keep going.
I just see everything as a home run, and then they some are, but then I have 90 failures behind me also. But that's parenthesis. But no, so I'm super proud that you guys took the step, and I really believe that also have created already flexibility in your life for like being with the kids. I know it's been super tough these years with 2 small kids, and that's I got my first kid 8 months ago. I can really see how hard it is for you guys. If I would start Sendev at the same time with 2 kids, I don't know if I would if I would be here today.
I think you made a great. I think you made a great point.
Okay, that's right.
I think you made a great point earlier, Nikola, when you say that like when things don't go well, or rather, where does the stigma come from that you shouldn't start a business with your friends and family? And the reality of, especially if you're doing high tech or any kind of innovation, 90% of businesses fail, right? And nobody wants to take a look at themselves and take ownership of that fail. So when that fails, it's very easy to start pointing fingers, independent of if it's your family or a best friend. You and I, Nikola, have both, like you mentioned, started even before this companies with very close friends. And it didn't work out, usually because there were different ambition levels and so on, and different visions for their lives, right? But if you can just understand that things are like that, be open about that communication, and if you can end it in a nice way. And I've always been able to do that with all the previous partnerships, and I know that you have as well. It doesn't work. It doesn't have to be that, if you go into a business with your family and it doesn't work out, that's the end of that family, right? But you need to be mature about it, I feel.
Yeah, and I mean, regarding friends, I've started 2 companies before this with 2 close friends, and we are still really good friends today, and just talked it out that it took a while to get there, that we should separate ways. But I mean, if you are have self-awareness, I think it's going to go well. But also if there are friends that reveals sides that are not so nice, maybe you shouldn't be friends with them as well. That's maybe a test also, that I mean, if they show that they're really greedy or just they don't have any self-awareness, put the blame on you, maybe you shouldn't be friends with them at all. The true sides come out when it's tough, I think.
That's a great point.
Yeah.
But I think communication is really important, and I'm a big fan of straight communication, and I think, and also talking things out before they happen, because if you okay, we take it as it comes, then sometimes you end up not being prepared in a situation. And as I said, as I often
are masters of that.
Yeah.
Not being prepared.
Yeah, I guess that works for some people, but it doesn't really work for me.
Yeah.
And I always try to see ahead what might be up there, and just see, did you talk about this, and what is your view, and what is your opinion on this, and if this was to happen, what would you say about that, so that you are prepared and it doesn't come as a shock to you. And I think that's much more easy.
I agree. And I think we improved also our communication during this, even though we have talked, like I said, every other day, 20 minutes on the phone. It's been more small talk about stuff, but we have improved our communication. We understood each other a lot before. The first 3-4 years of the company, because you and I are super different. I'm super just go with the flow, and you are super worried about the consequences. And I think it's a great match, but it's also a great resistance between us. But we have also come to the conclusion that we have actually misunderstood each other in 9 out of 10 times. But that was probably a big part of running the company together. And I don't know of all relationship otherwise if that would have taken 15 years to come for that communication to improve. So it really is tough. Takes a lot of work, but I really believe we have a better relationship, all of us, because of this.
Yeah, but to me, I have quite high standards for what I call close, or I call good or great communication. And I think that we're just still seeing ourselves in the beginning of something here, because there is still so much to work on. And it's the same thing when we're building the brand. I see it as a long-term thing, also over 10, 20, 30 years or so. And I think it's quite funny, because you guys will work closely with each other, on a day-to-day basis with Hydroxa. And then me and Jimmy, we talk because we live in the same house, so we talk about things. And then sometimes when there's a problem or something, then you and I talk, but it's not so often that we talk, all the 3 of us at the same time.
I don't think we have the opportunity because of the life situation. Some of you needs to be with the kids at all times. So it's.
But sometimes we just say, okay, now we need to talk, the 3 of us in the same room at the same time. But otherwise it can go,
From a business perspective, something that you talk a lot about is what you talked about just now, communication and feedback, right? And I think Nikola and myself are open that historically in all of our businesses, because of our personalities, that hasn't necessarily been our strongest side, in the sense that we don't necessarily like confrontation, and we associated it with a lot of negativity. Like whenever there's a problem that we would have is for too long, we would push it under the rug, which after some time comes back up.
Always comes up.
It always comes up, right?
Always.
And I think, Nikola and myself, both of us recently read a book called Radical Candor, where they speak about the importance of when things come up, you have to take care of them right now, stay in that uncomfortable moment. You, Sandra, from what Nikola has told me, have been very good always with taking those hard discussions and staying in those moments until they get solved. What do you feel that it is that you have and your mindset when these kinds of problems or confrontations or whatever come up, that you feel that it's no big deal, let's bring it up now and let's solve it? How do you get there?
I think, as I said, if I take it early, it doesn't have to build up to become some emotion that I cannot control. So in that case, I can often be quite calm about it. I can be upset, but I can be calm. I don't have to let my emotions take control. And also trying to be understanding, trying to always have like a positive thought on why is this person doing this, like trying to understand. Because people don't do what they do to be mean. Usually they have a reason, if it's fear or something else that drives them. So I try to understand that, try to see from their perspective, and then I try to give them constructive feedback instead of like yelling at them, or maybe even asking questions like, when you do this, how do you figure about this, and what do you think is the best way to do this, and try to get them to get there themselves, and I guess it's just who I am. I don't feel those situations don't make me so uncomfortable most of the time, and it can help me also to keep my calm and just focus on being constructive.
I just think it's a great personality trait, because what happens in the long run if you don't bring those things up, it goes from being a business problem to you having a problem with that person, basically. So it's a great perspective. We talk about the family issues now. Where is Hidroxa now, and what are the next steps for Hidroxa?
We are still very deep in the middle of everything, I would say. Basically doing a lot of development of the device and doing the regulatory work. And I would say that, that is still a struggle, because, when we were talking to people around us in our surroundings about doing this, especially with the regulatory part, like the CE mark, FDA approval part, like everyone we spoke with, they were like, oh, you cannot do that. That is too hard. And this is something that is usually done by like really huge companies with experience in this. So it's been very scary and still is.
Not the family with small kids.
No. Exactly. So, but maybe you can tell just a little bit about the process.
So I was at the job interview before Hydroxa started to take off. And during this interview, I mentioned that I have Hydroxa, and the plan is to do our own device with the CE marking and all of that, the regulatory work. And the interviewer, he started to laugh. And I was like, what? Did I say something wrong? Or then he excused himself and explained that, we have been doing that for another customer, and it was hell. So
it's impossible.
That's the one you remember on LinkedIn, and then you send the device to him.
True. So it's a huge process, but we are determined. So we will get there in time.
And just to stop you there for a second, for people to understand, obviously this is business bits from a business perspective. People think about those things as obstacles, and they are obstacles, right? But it's also the competitive edge that you create with all the other people, that you're willing to go through that horrible process, that fire, and nobody else wants to, and that will be that competitive edge for Hidroxa, amongst other things. Sorry, I interrupted you.
No, I totally agree with you. But so that has been a struggle. But where are we? We are in the middle of the process, I would say.
Yeah, and I think
going strong.
The goal is to have the machine out and FDA approved by the end of the year. So that opens up the US market and for us, basically. And we haven't been able to sell our current device there because we don't have an FDA approval. So that opens up the biggest market in the world for us. So that's the short-term goal. But all focus on the device. And then We will also CE market after FDA approval. But other than that, is you just keep pushing marketing and scaling up the marketing, and because it is 3% of the world's population who have these problems, and we have only sold like a few thousand devices. So just by simple math, you can see how much we have left of awareness and just to convince people that this works for them, that it's the right treatment. So we have really only scraped the tip of the iceberg here.
I think so as well, and because it is an issue like that, what we talked about earlier, Sandra, that doctors don't even know about the problem. How should your common person in the streets? And you're very aware that the awareness of this is not there. And when I think you guys did a fantastic marketing ploy here to start making people aware of the problem through TikTok. And Hidroxa is here as well, behind the camera, sitting here. We've done a fantastic job at that, at creating videos on TikTok that have gone very viral. And we've only been doing it, I don't know, a few months now, and have had over 50 million people watch the videos, and a very engaged audience that leaves a lot of comments because people are recognizing themselves in these problems. Can you tell us a little bit about that, how to raise awareness of this, and also your tactic here on TikTok? Where did that come from, and how did you come to that realization that this could be the right platform for it?
Yeah, I mean, it was a long process to get there. We have tried all online marketing strategies. We have done pretty well on SEO. We have done Google ads. We tried Facebook ads for a long time, probably 3-4 months. Didn't work out for us. There are similar products that really work out on Facebook, but we haven't had success there basically. And TikTok was we starting to see that was becoming really interesting. But I could never understand that we would have this amount of traffic so fast. So like you said, it's a big shout out to Hidroxa that done a great job there. But I also think that the platform is so engaging that people are not afraid to comment. Like Facebook and Instagram, people, they comment, but not in the same as much as on TikTok, because TikTok, they have a lot of engagement, and we know that the crowd are pretty young, but it's spreading anyways. They are telling their parents. We have a few thousand comments on all the viral videos, so we didn't know that TikTok would be it. But I think that the strategy is to try all the different marketing platform. We're also experimenting soon with Tabola, because we all also through the years found out that our device is not a one-time purchase. When you come into the site and say, hey, I want to spend 500 euros on this hands in water electricity.
With electricity,
it's a device that requires a lot of reading and retargeting. So actually our returning customers are way more valuable to us. So now we are trying to find more platforms where we can retarget basically the traffic that we already had on the site, to see how we can retarget them and remind them and try to educate them with reviews that this is actually working. But it's also a big struggle because we are in the medical tech that, for example, we can't do a Google ads retargeting because of their policies. So we are a little bit limited, which also makes it more complex to find which marketing platform can we use for this. So it's really trial and error all the time, and do as many experiments as fast as possible. Like what are we trying right now? How fast can we get to see if this is working or not? And then just go to the next thing. And we do that all the time as fast as possible, basically.
A/B test a lot.
Yeah.
Thank you guys so much for the discussion. I mean, I think I myself can probably wrap up that, the mission of the company of Hidroxa as is to help every person in the world that has problem with excessive sweating, that feels that it is a problem from them, right? That's a personal subjective experience. But for the people that are feeling troubles in their life for whatever reason with this problem, Hidroxa is a big solution to that. And a part of it is first to raise awareness for them that it exists, and then, make it available for them through your e-commerce and whatever is in store in the future of Hidroxa. So thank you guys so much for the discussion.
Thank you.
Thank you.
Appreciate it.